Hi everyone, my name is Dr. Roger Wong. I am a full-time faculty member in the Department of Public Health and Preventive Medicine and also the Department of Geriatrics at SUNY Upstate Medical University in their College of Medicine. My tentative title for this project is on rural-urban residents' education and subjective cognitive decline among middle-aged and older adults in the U.S. It's a project that's currently under peer review. Hopefully it'll be published soon. So my outcome of interest is SED, which is subjective cognitive decline. It is typically defined as self-experienced decline in cognitive ability, and a person that would be taking a cognitive test, they would probably show up as not meeting the criteria for cognitive impairment. About a quarter of all older adults 60 years and older in the US have reported SED, and SED is important because there's been one systematic review that has found that those that have reported SED have a 2 times increased risk for dementia, which I think many of you might know. There's currently no cure and no definitive preventive approaches for dementia. So I think SED is an important early indicator for cognitive impairment later on. So the other parts of this project are looking at virality and education, right? So let me talk about virality and cognition first. Based on the 2010 health and retirement study data, so this is adults over age of 50, they have a 79% increased risk for dementia based on this 2018 study. And a separate study published in 2022 looking at HRS data from 2000 through 2016 found that there was a real penalty on cognitive function 40% larger compared to those that were living in urban settings. And then finally, based on the 2003 through 2007 regards data. So this is adults, I think 45 years and older. It's a national sample also for the US. It's a risk factor for stroke study. That's what the S stands for at the end. They found in this data set that those that were living in rural areas have a 34% higher odds of cognitive impairment. So now let's also look at education cognition. There's been a lot of research that's shown that education is protective for cognition. So starting with one of my students' papers published in 2024, we were looking at the BRIFIS, the Behavioral Risk Factor Surveillance System data. We were looking at a sample of US adults 45 years and older. So people that graduated from college, they had a 45% lower odds of subjective cognitive decline compared to those that had less than high school education. And then a separate study I also did in 2024. This is using the NHATS, the National Health and Aging Trend Study. It's a national sample of US Medicare beneficiaries 65 years and older. So based on this 10 years of data using survival analysis, I found that college graduates had a 43% lower risk for dementia compared to those that had less than high school education. And these mechanisms are thought to be through cognitive reserve. So a lot of previous research in this area has suggested that education builds cognitive reserve, which is defined as the ability of the brain to maintain cognition in response to aging or disease. So some of the gaps that I tried to address with this research, first is that I haven't really found so many papers looking at the relationship between virality and cognitive decline. And I haven't really found a lot of research on virality and cognition in general, especially after 2020, which I think is an important year because due to the pandemic, a lot of people were kind of moving to like different areas, especially after like telework became more common. So that's kind of one thing I was kind of wanted to update the literature on. And then the second is that, at least from what I could see, I could not find any papers looking at the relationship between all these three constructs: virality, education, also cognition. So I had two research questions. I wanted to see first, what was the association between rural urban residents and subjective cognitive decline? And then I also wanted to see, the first one is probably not that innovative, right? I pretty much hypothesized that living in rural areas was going to be associated with increased odds of cognitive decline based on lots of literature in this area. But my core question I had was, okay, so I wondered if maybe for people in rural areas, if we provided more accessible, like an affordable education, for instance, would that kind of buffer their risk for cognitive decline later on? So that's essentially what I wanted to answer with my second research question, whether education moderates the rurality and cognitive decline relationship. So I took my data from the 2022 BJPsych. It's the most recent data as of this recording right now. I took data from the cognitive decline module. So it's an optional module that only 12 US states in 2022 completed. I don't list those states here, but I mean, it's publicly available. Anyone can just look it up. That cognitive decline module, it's only asked to US adults ages 45 years and older. So that is the sample for this. It's middle-aged and older adults. And my sample size was around 6,400. My outcome of interest, again, is SED. So it's specifically in the BJPsych, they asked a question, during the past 12 months, have you experienced confusion or memory loss that's happening more often or getting worse? It was binary, so it's either no or yes. My core independent variable of interest is whether they were living in a rural or urban county. And this is a BJPsych calculated variable. It's not really answered by the respondent, I think. And then my moderating variable is education. This is also BJPsych calculated. So they just have this created already. There was 4 categories. It's either less than high school or equivalent, some college but you didn't finish college, and then college education, which is 4 years or above. In my regression models, I adjusted for sociodemographics and also some health variables, and I selected them mostly based on lots of previous research that looked at kind of the confounders and also risk factors for cognitive impairment. Okay, so for my analyses, my core analysis is basically I did a multiple logistic regression. I first created one model with unadjusted relationship between rurality and subjective cognitive decline. Then I adjusted for sociodemographics that I've listed on the previous slide. And then my final fully adjusted model, I adjusted for sociodemographics plus the health variables that are listed on this slide as well. Missing data wasn't too bad, I think. It was about 9% lost of my full sample in list-wise deletion. So I'm like, might as well just do multiple imputation. So I think I did 15 imputations. And so that's going to be the results that I showed here on these slides. But there were no differences in any of my conclusions for multiple imputation versus the list-wise, the default method. Okay, so again, my sample size is around 6,400. About 19% of this BJPsych sample was residing in a rural county, and also 11% reported subjective cognitive decline. You can see a little bit higher of that proportion was for those SED in rural areas compared to urban, and that was a significant difference based on the chi-square test. And then we also, the most common education reported was college education, 44%, and then the most common age group was 16% of the respondents were between 65 and 69 years old. Okay, so my first question, again, I wanted to look at what is the relationship between rurality and SED. So I did 3 regression models, unadjusted, adjusted for sociodemographics here in the middle, and then fully adjusted for sociodemographics and health. I kind of cropped out the covariates on the bottom here, but you can see that in my unadjusted model, people that are living in rural areas compared to urban, they had about 13% significantly higher odds of subjective cognitive decline. And then it's still a significant association in my fully adjusted model for sociodemographics and health. About a 9% significantly higher odds of subjective cognitive decline for those that are living in rural areas. And then this is not really my research question, remember, but I thought it was also interesting to see like the more higher attainment of education was, you can see the odds ratio, it becomes more protective for cognitive decline. And then in my fully adjusted model, it's just college education, 15% lower odds of subjective cognitive decline compared to less than high school education in my fully adjusted model. Okay, so that was my first research question, right? And then if you remember my second research question, the moderation, I wanted to see, and I did this through an interaction effect between virality and education, if education might be beneficial, buffer the odds of SED for those that are living in rural areas. I thought the results were interesting. So first of all, the interaction between virality and education, it was significant for the joint significance test, p-value is less than 0.05. This was kind of contrary to my hypothesis. So I found that urban residents with increasingly higher levels of education, they had lower probability of cognitive decline. So if we take a look at these specific numbers, for instance, so if you're living in an urban area and you have less than high school education, you had about a 12% probability of SED. And if you're living in an urban area and you had a college education or above, it's about a 10% probability of SED. So this difference was a difference of about 2%. It was significant. So you can see that you have a lower probability of cognitive decline the more education that you get if you're living in an urban area. You don't quite see this for rural residents. So for instance, if you have less than a high school education and you're living in a rural area, it's about 11.5% probability of SED. And it's also the same for college education for those that are rural residents. So it's a very small difference, and you can see this difference was not statistically significant. So I think you can see this more visually in my graph. So there's kind of two things to take away from this. First of all, you can see that in general, from the first research question, people that are living in rural areas, they have a higher odds of cognitive decline. And then from my second research question for the education as a moderator, I was saying on this slide that, my previous slide, that education seems to have more cognitive benefits for those that are living in urban areas. So, sorry, I should have mentioned this. Cognitive decline is on the y-axis. Urban and rural residents is on the x-axis, and then the legend is the different levels of education. So you can clearly see from here that less than high school education but living in urban area, you kind of have the highest predicted probability of cognitive decline. And then the more education that you get, it's having, in general, a positive benefit for your cognition. And specifically, urban residents with college or above education had the most protective effect for their cognition. So let's summarize everything that I just talked about. First research question, I found that people living in a rural area and also lower education, you have a higher odds of cognitive decline. And then for my second research question, it appears that higher education has cognitive benefits only for urban but not rural residents. And in retrospect, I think that kind of does make sense because of disparities in upward mobility and also healthcare in urban versus rural areas. So, for instance, you have more opportunities for upward mobility in urban areas. So the pathway that I kind of talk about in the paper in peer review right now is that if you have higher education, that leads to more kind of occupational opportunities, more so in urban areas compared to rural areas. And so that benefits your cognition later on. And like the reasoning I have is like there's a lot more types of like jobs available in urban areas that kind of are more cognitively demanding, whereas in rural areas it's more like the same, more limited jobs that tend to be a little bit more physically demanding. So that's kind of the first mechanism I talk about in the paper. And then the second mechanism is that there's kind of well-documented gaps in healthcare and social infrastructure in urban versus rural areas. So I think that kind of leads to the differences in cognition based on education. So for those that are living in urban areas, the more education you have, the more you're able to kind of leverage your health literacy in navigating kind of like the health care infrastructure in urban areas. So that benefits your cognition later on. You don't really get those benefits in rural areas because there's not that much healthcare and social infrastructure. So that's the reason why I don't think education is having that much benefit in rural settings. So I think these findings have some implications for research practice and also policy. For research, I mean, I think I give some plausible mechanisms for why education is benefiting cognition for only urban residents, but I do think some further research is really needed to kind of directly look at these mediating factors. So that's kind of for research, future research. I think for clinical practice, this is kind of reinforcing how people that are living in rural areas, they might have an increased risk for cognitive decline. And then in terms of policies, this is showing that the higher education, it appears to be quite beneficial for our cognitive health. So it's kind of pushing for more affordable and accessible higher education. Sorry. And then some limitations. So the Griffiths data I'm looking at is cross-sectional, so I'm not trying to make any sort of causal associations. Cognitive decline is subjective. It's not objective because this is a huge data set. And also the geographic data is quite limited in the Griffiths. I could either get information on either rural or urban. Thank you very much, and please let me know if you have any questions about my presentation.